I think knowing how to manage most of side effects from treatment is really important. We formalize a plan, and then going forward, you execute the plan, but you need to know how to treat symptoms, and you need to know how to use the proper drugs, and, kind of identify symptoms quickly, so that we can treat them quickly and then keep patients on treatment, because ultimately these treatments are what's going to keep patients living longer. And typically we start with one treatment regimen and we stay the course as long as it's working without too many side effects. We kind of stay there. We use scans and imaging to see how the cancer is responding. And if the cancer stops responding to treatment or the side effects are too toxic, then, we talk about switching to the next regimen. But, some of these patients stay on regimens for months and years now, which is wonderful. And I think for me, the beautiful take-home thing is that there's a lot of hope for these patients. The field is, evolving quickly with several new drugs developing over the past few years. And, women are living longer. And for that, we're really grateful.